September is Ovarian Cancer Awareness Month. So today we are discussing facts, advice, and tips for prevention.
Dr. Dario Roque with Northwestern Prentice Women's Hospital joins us now with more. Thank you for coming in. This is an area of specificity with dealing with ovarian cancer. Tell us a little bit about the disease itself. Is it rare? Is it common? Is it survivable? How do you, give us the 411 here.
So usually there's about 20,000 women that are diagnosed with ovarian cancer in the United States. So number-wise, it's not one of the most common types of cancers that women are affected by. But even within the GYN space, so when you consider ovarian cancer, endometrial cancer, cervical cancer, even though it's not the most common, it's actually the deadliest. Part of it is because the majority of women present with more advanced stage disease. And that has to do a lot with the fact that unfortunately, right now, we do not have any good screening tests to detect ovarian cancer. So by the time women present with some of the symptoms and undergo through some of the testing that leads to the diagnosis, they already have fairly advanced disease. And primarily the way we treat it right now is a combination of chemotherapy and surgery. And we also recommend genetic testing because about 25% of women develop the disease as a result of genetic mutations that may have been inherited. And that is like the one factor that we can actually control for and actually recommend testing for the patient's families as a way to prevent it. But that's essentially where we are right now with disease. It can be survivable if it's detected in earlier stages. Once it's in a more advanced stage, which again is the more common form of the disease, it's more difficult to survive. But with newer medications that have been developed over the last few years, more of these women are definitely living longer.
Okay. So good news for you guys. You just got a sizable grant to start doing some more research on the disease itself and treating it. Can you tell us a little bit about that?
Yeah, so this grant was through the Friends of Prentice, which is a wonderful organization, and they funded over $350,000 of grants this year. I obtained one of those grants, and mine is primarily focused on ovarian cancer, specifically looking at the way that cells respond to a type of chemotherapy that we can often administer during surgery. So we're very, very grateful to Friends of Prentice for providing us with this funding, and the hope is that we can benefit women by our findings.
Okay, so you're about to start clinical trials, probably in January or so. How can women take part in this?
Yeah, so it's something that we are always encouraging women to participate in any clinical trial that they will be eligible for. We talk about all the different clinical trials that our patients could be eligible for during the visit, either at that first-time visit or sometimes if the cancer has come back. That's another time where we look at all the trials that we have available and offer it to them accordingly. And I always encourage all of my patients, if they qualify for a clinical trial, to enroll in one, because it is the best option for many of them, in the sense that a lot of these trials are looking at medications or treatments that might work better than the current standards.
You talked about genetic testing kind of being your only preventable steps. If you do test and are genetically predisposed to it, can you get regular screenings to watch out for it?
Absolutely. So there's still screening in that setting doesn't always help still, but the best we have is doing ultrasounds, and there's a blood test called CA-125, but it's still not recommended because even in those settings, it's very, very hard to detect the disease on its early stages. So the best prevention strategies in patients that do test positive for any sort of genetic predisposition to ovarian cancer is actually undergoing a risk-reducing surgery to remove the ovaries and fallopian tubes. And usually we would recommend that after the woman is done with childbearing, but typically after age 35 or 40, depending on the specific mutation.
Okay, a lot of women may be thinking, oh, okay, well, if I go and get my regular pap smear, that maybe that could help prevent or detect. That's not necessarily the case here.
Yeah, and I'm glad you brought that up, because I think it's a major misconception in a lot of our patients that they say, well, I've been very good about getting my annual exams, and all of my pap smears have always been negative. But the pap smear itself as a test is only designed to screen for cervical cancer. So it's not going to detect ovarian cancer. Even uterine cancer, even though the cervix and the uterus in a way are connected. The pap smear sometimes can detect uterine cancer, but that is not what it's designed for. So just because your pap smear is normal, it does not mean that you don't have ovarian or uterine cancer.
Oh,
Yeah, I'm glad you guys are getting more money to find out more about this disease.
Yeah.
Dr. Roque, thank you so much for being here.
Yeah,
Really
thank you
appreciate
for
it.
and good
having me.
luck in your research.
Yes,
Thank you so much.
absolutely.